Okay, we got a problem now.
Okay.
All right, so therapists and psychologists and sometimes counselors?
Uh-huh.
Not really, right?
Well, it depends on how we're using, if we're using counselor and therapist,
Yeah, okay. Fine.
is synonymous.
Right. So they talk to people.
Right.
And then say, hey, I think you should be on drugs.
Okay. You need medicine.
Yes. And then they send that to a psychiatrist / doctor.
Mm-hmm.
And
yeah.
Right?
Yeah. Yeah.
And say, hey, my recommendation is these drugs.
Mm-hmm.
Okay. Psychiatrist gets the recommendation.
Okay.
From somebody else.
Okay.
What happens next?
Yeah, so then the psychiatrist will accept that referral, or if they choose to, right?
Okay.
They can accept that referral, but then they're going to do their own evaluation of the patient.
Okay.
So they're not just going to take just the referral for just, at face value.
So psychiatrists, a lot of the time, since therapy and counseling, I suppose, is cheaper than psychiatry.
Yeah, you're definitely going to pay
to
more.
A psychiatrist.
Yes.
Okay. So most people are going to go see a therapist or a counselor, get recommended drugs, and then psychiatrists or doctors going to do their thing.
Right.
Okay. So that's how.
And it really depends on the way the whole thing is playing out, right? Okay. So, for example, I know a practice here or in our community, they're psychologists. Okay, so they're counselors, therapists, and they have someone. So it's a large group of them, large practice, and then they have a psychiatrist there.
Okay,
and so they will bring in that psychiatrist to work alongside with the counselor in working with specific patients, especially when you're starting to deal with, looking at the medical parts of looking at the brain, examining the brain, the brain functions, and all that. And then they may be able to help go deeper into, more trauma therapy and that kind of stuff, where you've got someone that you are, without question, you're going to be paying more, right?
Right.
But they're going to be working with them. In other instances, you don't have that. So you don't have, like, the psychologist or the counselors may not have a psychiatrist that's part of their practice or that they always refer to, or those kind of things. And so when they make referrals or recommendations, that psychiatrist is really functioning as a kind of an individual party at that point. And they're going to have to see the patient and do their own evaluation of that patient. Because any medicine that they are prescribing, they're on the hook for, right?
Right. Okay.
So it's not that they don't trust a psychologist or the counselor, therapist, but at the same time, they're the ones responsible for the medicine.
I wouldn't trust them,
and the patient's going to have to come back and see them if they're staying on medicine.
The psychiatrist.
The psychiatrist.
Okay.
Has to be seen on a regular basis, on whatever the basis the psychiatrist determines, to be able to see how well is the medicine working. Are there any negative side effects that are coming up because of it? Because they'll give X amount of refills, and then before that next refill comes up, they've got to come back and see the psychiatrist.
So there's more consequences for psychiatrists when it comes to drugs.
Absolutely. Yeah, because it's like like when you go to see your primary care physician and you've got high blood pressure or diabetes, and they're going to put you on some medicines, and then you've got to come back and do labs in a few months, and then they want to see you to see how's the medicine working, how's it actually, that kind of thing. It'll be the same thing with a psychiatrist if you're having to stay on medicine for an extended period of time.
Okay.
Yeah. Where it gets a little interesting is psychologists can refer you back to your primary care physician. And the primary care physician can be the one to prescribe medicines.
Oh, so they can pass off the blame for any problems?
Well, not necessarily they're passing off the blame, but the psychologist needs either the primary care physician or the psychiatrist.
Oh, the psychologist.
Yeah, the psychologist.
Okay,
yeah.
Okay,
so primary care physician doctors will, if they're talking with the patient and they're they've got a good, enough understanding of the patient. They may go, yeah, we agree with the ADHD or with the anxiety or with the depression medications. But when it's getting a little bit beyond that, when you're starting to deal with things, like, antipsychotic medications and that kind of stuff, dealing with things like bipolar disorder or whatever, or multiple personalities, then at that point in time, the primary care physician may not feel comfortable prescribing those meds. Okay. And so that's where a psychiatrist would have to come into play.